Well, you heard from him before on our show. We're very privileged to have Dr. Larry Lambert, who's an internationally recognized neuro-optometrist. And he's actually only one of the 1,349 optometrists that are certified worldwide in vision development and vision therapy by the College of Optometrists. And I have to tell you that it's an unusual specialization. Now, my husband and I have been privileged to go there. I always like to kind of sample what our speakers and experts do. And I have to tell you, I thought I had great vision, but he sure put me to the test. And so I'm so glad when you come here, Dr. Lambert. I know you're doing a lot of good things for the average population, but you're also in a lot of the retirement communities, and one especially that I'm so fond of course, is the Regent's Park of Boca Raton. So tell us what you're doing there.
Well, I go into Regent's Park and I look at folks there who may have had falls, strokes, or concussions. And I look for functional vision problems. In other words, that's different than looking at how do they read letters on a chart or seeing if there's an eye disease. Instead of looking at the eyeball as an organ, we look at how they function with their vision, more as how vision is as a sense. So I look for things, are the eyes working together well? How is depth perception? 20% of the fibers in the eyes go to balancing centers. So I work with falls prevention. If someone's already had a fall, we try to prevent another one. Or in the population where I can identify weakened binocular system to try to basically prevent a fall in the future.
And so people generally have no idea it's from their eyes. They probably figure their legs are weak or something. They're not paying attention. But there's something more important. And just as said, how did you discover this when you were, of course, becoming an optometrist and you were doing what normal optometrists do? But you were never normal, were you?
No, not at all. Not at all. I'm a little different. But I had fun with it, though. But I started going to optometry school. My father had an optical shop where he made lenses, and I thought, I'll become the eye doctor. And when I was there, I thought about, the glasses, the contact lenses, and correction and eye diseases. And I was exposed to lectures where they talked about functional vision. And I got very interested in that. And the more I learned about it, the more I did not know, because it wasn't mainstream. And then I did my fellowship, and then I thought I knew a little something. I've been practicing now for 30 years, so now I know enough, to basically do it well.
To be dangerous.
Yep, to be dangerous. And so it's a very interesting area. I work with functional vision at Regents, and then I also work with sports vision training, where I work with professional teams and athletes to develop their visual skills for the game.
Now, since you told me that, and we've had enough interviews that I understand that you're really into the sports vision therapy, I've been watching the team, of course, the Heat. That's my team. But everything aside, and I'm not like that. Now I know why some wives go crazy with their husbands for all the sports, but my husband and I do prepare ourselves to sit down for the Heat. And I've been watching them, and I was wondering if you got a hold of some of them, maybe they'd see the basket better. Maybe they think they're great, but they don't always hit the basket, even LeBron. Right.
There's a lot of reasons for that, and there are also reasons that can make you potential for fall. And one of them is if your eye teaming system is weak, you'll judge where the basket is a little differently as your eyes fatigue. Now, probably these guys at an elite level, they don't have that happen to them, or they've just trained it. They've done sports vision training to train that out, so they're consistent all the time. But what happens in the falls population is they can have a weakened eye teaming system, and I see that at Regents a lot, where the eyes are having trouble working as a team. They work as a team, but the forces that hold them together are weak. And as they weaken, the perception of where something is will change, like maybe the leg of the chair. They think it's here, and then tired in the afternoon, they misperceive it as an inch away from where it really is, and they'll just trip over it, have a fall. So these are called binocular vision problems, and that's what we fix at Regents Park. Our program is unique there. They're the only ones offering it in the area. And in fact, this on the 15th, a study was just released that said binocular disorders linked to falls and fractures in the elderly. And it was looked at by ophthalmology through the Medicare population and found that this binocular vision dysfunction actually had more potential for falls than cataracts or macular degeneration. So we're ahead of the curve at Regents. We're working with this now, and our program is developed. The therapists are very good over there. The staff is great over there. I really like going there. It's my favorite place to go because it's like family there. I walk in, everybody cares about the patients. I go and see the patients. They see me. It's nice on one level, and you walk to the different wings, and I see a lot of the same people every week, so it's really nice.
It is a very beautiful place. And by the way, since we're talking about that, let me just mention, everyone, if you're not doing anything and you would like to go to a wonderful fair, it's actually called an expo, on May the 17th from 10 to 2, they're going to have a big fair. When they do something at Regents Park, they really do it. Mm-hmm. So we're all going to be there. We're one of the sponsors, and it's May the 17th from 10 to 2. But I want to get back to what you just said. When my husband and I went for some therapy from you, it was interesting. You put these colored glasses on us, and, of course, at first I felt like I was getting a headache. Mm-hmm. But then it appeased. It was okay. But then what you're saying, I guess, is that you're training our eyes to do something, and I'm not quite sure what, but it got better as I had these glasses on.
In your case, we're training the binocular vision system, the way the eyes hold together as a team, to strengthen that, because that's a little weak in you, and that might cause you to misperceive exactly getting into a parking spot certain times of the day or things like that.
I'm better, by the way. Yeah. You've taught me some things, too, about it, but I do have to practice. That was the one key that I haven't been really good at.
Right. You have to do the drills and the exercises that I give you. It's like physical therapy for the eyes.
And I don't know how I can explain that. What do you call those little things when you brush your teeth, you put between your teeth and try to fit this into a hole?
Well, you were using a, what is that called? A floss, plastic flosser.
Right, exactly.
And putting it into a straw, holding the straw in one hand, the flosser in the other. You can do it with a toothpick, piece of spaghetti, and bring it in close to your eyes, a little further, close further, and put that in. And that actually works the eye muscles, trains your convergence, which is weak in a lot of people. It's found by the age of 60, 43% of the population has some weakness in that system.
But we never think about that.
We don't think about it because we don't think we exercise our bodies. We go for anti-aging, things like that, but this is anti-aging for the eyes. And studies have shown that in 12 to 14 hours, you can bring these skills down to more youthful levels very quickly in the senior population. It's been shown that visual skills training will reduce car accidents 50% and improve braking distance 22 feet at 55 miles an hour in senior drivers. All right, it was better than driver simulation training. So again, this is what we're doing at Regents, program for that. We also do stroke rehabilitation. This can be a different set of problems where people have no vision to the right or the left side, and what's called their concept of their midline shifts over to a side. So someone may miss their food on the plate because they don't see it exactly where it is. Their vision perception is off. Or they bang into the doorways a little bit, or always brush into the side, or may look like they're leaning, or they feel like they're walking in a straight line down the hall, but we see them veering a little bit. But their perception of that is off because of the peripheral vision being attenuated on one side. And, peripheral vision, I already started to talk about it, goes into the brain 25% faster than the part of the eye that reads the letters on the chart, and 20% of that peripheral system is for balancing. So if that's out of kilter, it throws off your perception of where exactly is the doorway I'm walking through, or where is a straight line.
And for those who have macular degeneration, it's even more serious now. I'm watching Bill when he's eating.
Right.
It's funny. He was telling me that I'm cutting up the salad vegetables too tiny because he can't get them on the fork properly, which is very interesting for me because I like them small. But bigger, he can see them. But yet, I see when he's putting a glass, it gets a little too close to the edge of the table because he's not seeing it. Is that peripheral?
That's peripheral. That's also, in macular, you lose your center vision. But the concept of being able to spear your food or put the glass back in the right place, we call it targeting at Regents. And at Regents, we have programs to improve this targeting skill. We have different equipment, and in fact, one of the therapists, Suzanne, developed a piece of equipment that we use over there for this skill. So again, targeting is called, and we improve that skill.
Well, but for people like Bill who isn't really living at Regents Park or going there, he were going to your practice to get this from your therapist. So if any of you want to do something like that, now I'm going to give a couple of addresses here. If you're interested in a fantastic retirement, it's either a skilled nursing home if you want it for that, or you need to go because you're going to have some sort of rehab, you can go over to the Regents Park Boca Raton. And that number is 561-483-9282. and they're on the web at regentsparkboca.com. Now, if you want just, though, to go to Dr., our wonderful Dr. Lambert, as we are doing, there's probably, I don't want to get into the test yet that you have, but what is the website for them to get on that?
drlambert.com. In other words, www.drlampert@AOL.com.
No.
I'm sorry,
no,
that's my
.com.
That's my email.
No, I know.
Just
.com.
.com. Right.
So that's drlambert.com.
Right.
And you can make an appointment as we do. We try to go once a month, and we are trying to exercise our eyes. Now, my eyes, I'm not having that problem that Bill's having, but I want to strengthen what I have because, I do so much reading. In fact, we just got finished proofreading for our next issue. And I noticed that, since I've spoken to you, I was watching what my eyes are doing. Sometimes they see an L instead of an I, but that's common anyway, I guess, because of the type is so small. But I'm very interested in getting my eyes in the best condition I can. And by a little exercise, he sends us home. But there's something wonderful that you have done as a scientist, actually. You have developed a program that people can do this by themselves after they see you, and then you go through it, on the Internet. Now, are you ready to talk about that?
Yes. Eye Performance is a software program I've developed. It's web-based, so you just need an Internet access computer. And you need these 3D glasses for a couple of the elements. And I set people up with that. We train them in the office how to use the system, and they do different exercises. The one for your eye coordination is called Vergences, Vergences. You converge the eyes, you turn them in. When you read, you diverge, the eyes go out when you look far away. And it takes these skills, muscles, nerves, brain, and it trains them up and balances out. Also, it's sort of like, you have a bicep and a tricep. You want to train both of them in the proper, proportion to each other. So this makes sure you do that with the eye muscles. It trains the convergence and the divergence. As you improve that, that's like anti-aging for the eyes. You take the eyes back to more youthful levels. Your ability to scan the environment, make eye movements that are accurate, improve. And so I use it anywhere from Regents Park to the ball teams. I work with the Minnesota Twins. They used it last year on two of their minor league systems by doing these Vergences and some other drills we have on there. One team improved 35 points in team batting average, the other 19 at the All-Star break. So they just had me back to spring training to do all 4 of their teams this year.
Well, that's marvelous. So it's catching on, it sounds like, and the nice thing is that you have a program because you can't be everywhere.
Right. I wanted to make this accessible to everybody, everywhere. And, we'll get ready to launch soon where we'll make it available nationwide. So right now it's basically people I know. And
it's a little, what we call a beta site, right? You want to get this done. Yeah. Well, the good part is they can come see you first, and that's what they should do to get their eyes evaluated and make sure their vision evaluated and make sure that everything is good, because if something isn't right, you'd be the first one to send them to an ophthalmologist.
Sure, of course.
So it's a good way for them to see what's going on. So don't wait until you've fallen. That's the whole thing, right? Do something now.
Exactly.
But if you have fallen, that is a clue.
Right. There may be. It's different if you black out and fall. Maybe it's not the eyes. But if you just misstep or trip over something, you should have your vision checked. It's a large percent of the population. Again, people who had this problem were 27% more likely to have a fall, break a bone, according to this study that was just done in the ophthalmology literature. And
people who have macular degeneration are even more prone to be able to use your test, because most of the time there's nothing you can do unless there's special glasses or something. But you're going to a different way. You're going to the very modern way of doing therapy and testing
the function of what we use our vision for. I had a woman this morning at Regents Park that has macular degeneration and can't read print, but she has intact peripheral vision. So we're doing drills and exercises to tune up, let's call it the acuity of the peripheral system, so that she'll be able to navigate better, balance better, and just see where things are in the room better than she would have without the training.
This is interesting because I know it's off the subject of the Regents Park, but I want to go back into the sports. What happens when you go to meet with these people who've never heard of what you do, and this is a baseball player or a golfer or something? I mean, do they understand what you're telling them? Do they know that's a problem? Or you have to do a test to show them, right? Do they say, I never knew?
Yeah, because most of them, like everybody, it's like, oh, my eyes are fine. I see 20/20 on the chart. You know, I had one player that was 20/10 on the chart. He could see half the size of 20/20, but he couldn't hit a baseball coming at him. And he was with the Cubs. He batted 200 in the States here. After doing the visual skills training, he went to Japan, became most valuable player, consecutive home run record, 17 hits at 21 at bats. Would tell you that vision training changed his career because we worked with how the eyes function instead of the eyeball as an organ. You know what I mean? I mean, even the U.S. Army is doing this now, and the work we do at Regents in concussion patients, they found that many guys coming back with blast injuries had 20/20 vision, healthy eyeballs, and they would dismiss them and say, there's nothing wrong with your eyes. But they had problems, the biggest one being this convergence insufficiency. It was affecting their reading, giving them headaches, spatial judgments, trouble sometimes even walking around in stores with feeling like things in the peripheral vision were kind of weird or wacky, and now they actually have a specialty at Walter Reed and 4 other Army centers where they're doing this neuro-optometric rehabilitation with the soldiers coming back, and they really deserve it. You know.
So did this happen to them when they were in the war,
yeah,
or
they had
had it before?
No, well, you can have a series of concussions, but most of the time these were blast victims. You know, where a bomb went off and they got a concussion. Came back, 20/20 vision, nothing wrong with the eyeball as an organ, but had vision problems, functional vision problems.
So as you and I look at each other, you can't tell I have a problem, and I can't tell you have a problem,
exactly.
right?
Yeah, these are called undiagnosed vision problems, and that's exactly why it's called that.
Undiagnosed, huh?
Yeah,
and
because you have people who are not aware that it even exists. And then, you brought up the baseball players. It's funny because they brought me into an instructional league, they call it, and wanted me to work with the 11 Latino players. And these guys were very macho, and they walked in the room, there's nothing wrong with my eyes. I do a couple tests, and when they couldn't do a few things, they went, oh, now I understand what this is. Yeah. And they actually had an interpreter, so it was interesting to work with them.
I'm sure it was. And so how do they see? What do they see first that's not working?
A lot of times I'll do what's called a Worth 4 dot, which is a series of lights on the end of a flashlight. We call it my little thingy.
Oh, yeah, you did that with me.
And are all the lights on? And we put filters on, red in front of one eye, green in front of the other eye. Can you see all the lights? Do some of the lights blink, turn on and off? Do some of the lights split apart into 2? Looking at different skills like that. And that's when they'll say, oh, you mean there were 4 lights there? I only saw 2. Well, that's because momentarily your non-dominant eye kind of shut on and off on you a little bit. If that's happening while you're trying to hit a ball, it's going to affect your batting average.
Now, you see this so you can record this, then you can show it on a sheet, or you...
No, they just see it themselves. They sit there and go, I take the glass, oh, there were 4 lights there. There was always 4. You just saw 2. It means your left eye was intermittently shutting off. Just center vision, not the peripheral vision, but center vision was because the eyes were weak at holding together, the brain will ignore the center vision of one eye once in a while.
Okay, so now what would the therapy be for that?
I would do vergence activities.
What does that mean?
That means the exercises that work the crossing and uncrossing of the eyes.
But my mother told me never to cross my eyes, or they'd stay that way.
You've got to do it systematically in the right way, and you've got to diverge in a certain relationship to how much you converge to keep it balanced. You're not just working one direction. And that's what led to those increases in batting average in people with normal eyes and 20/20 vision. But by tuning that system up. And that's what we do at Regents Park also, is tune that system up for seniors, and it helps prevent the falls and improves their driving safety.
Well, are you doing this for young people, or is this because young people don't have this problem? Is this something that happens in aging?
Some young people. It's thought that about 17% of the population when we're young, by the time we're 60, I mentioned 43% of the population has binocular vision problems. The young people, it would be kids who have trouble with 3D movies. Most people who... about 25% of the population is supposed to be going to have a problem with 3D technology in movies. It will either they won't see it or it'll give them a headache. They just won't feel good with it. And
what causes that?
Well, their eyes are weak at holding together. It's called a marginal binocular system. The American Optometric Association said that's going to be the leading cause of that, is people who have these weakened eye teaming systems. Their eyes work as a team, but they do weakly. W-E-A-K-L-Y, weak. Working together as a team.
I've always wondered about 3D. I love them. That's so fascinating, isn't it?
Yeah, and some people are like, they're naturals at it. I see the 3D, it's coming off the screen. Other kids will sit there, I don't see the 3D, or, oh, this is making me dizzy or not feel good. And these people who are dizzy, don't feel good, or don't see it are the ones who likely have these binocular vision problems.
This is such a big subject, isn't it?
Mm-hmm.
How did you realize that this was the right thing for the elder population? What came first, the sports or the elders?
I actually started out doing the sports and children who had reading problems because of their visual tracking and all that, and then it evolved into the neuro-optometric rehabilitation of, the head injury strokes a little later in my career. But actually my areas now, I tend to do a lot of sports and a lot of, at Regents Park with the senior population. Again, strokes, head injury, concussion, and then these binocular.
Strokes is another whole subject, because I know I have friends, or I've had a very special friend who his one side is totally, of course, numb. In fact, we laugh about sex. I said, how do you manage that? Where do you move? What do you do? I always have to make this a little bit light. That's right, because there's a part of this man, but he doesn't see things going on his left, where he's paralyzed. Do you do something for that?
Yes.
How?
Again, that's a hemianopsia. I do a couple things for that. Number one is look for, is there a midline shift? In other words, if the vision used to be like 180 degrees and now it's 90, a lot of times your sense of center, say you lose the left, your sense of center shifts over to the right a little bit. And you may veer right as you're walking, bang into doors on the right side, things like that. So we move that midline over to center using special prisms we use at Regents Park called yoked prisms.
The ones that I had on, so those
you have
prisms
them on,
that you put into off?
So we have them and they rotate. Do I want them to use them what we call base left, base right, base in, base up, base down? And the therapist will use them in the therapies to straighten that midline out, and the balancing improves. The walking. I mean, we have one fellow who couldn't use the motorized wheelchair because he was banging into the walls and everything, and we put these prisms on, and he started to go straighter.
We had to wear the prisms?
He wore them while he was...
Oh, but isn't that a way to train using the prisms?
Yep,
because
we do both. We do them compensatory, where they can help center the midline, and then we use them for training, where we're going to train the midline or train the binocular vision with the prisms.
You're just getting it all. Every day. Another thing has just occurred to you. I can see you don't sleep very well. You're probably thinking all the time, as many of us. Don't forget to go over to the Regents Park of Boca Raton. It's going to be a big health and wellness expo on May the 17th. I believe that's a Saturday, as a matter of fact. It's from 10 to 2 at Regents Park, and Regents Park is easily accessible. It's over there off St. Andrews and between Glades Road and Palmetto. And you can call them. I'll just give you a phone number to call them, and you can get directions. The number is 561-483-9282. 561-483-9282. Now, if you are going to be working or going into a rehab center, of course, you'll be able to have Dr. Larry Lambert help you there if you're at Regents Park. But if you just want to reach him on your own, as we've been doing, you can certainly go over and then call him and then get to his. Let me give you his website. It's drlampert.com. drlampert.com, and you'd be able to make an appointment with his wonderful therapist, Suzanne.
Sharon.
Sharon, sorry. It's close, right?
Yeah,
it's close. Good. But Sharon is terrific, and she sets everything up, and she stays with you, and I think that, you may be able to, it's funny, when people, it's not funny, but when I met people early on who were artists, and they got macular degeneration, but they became impressionistic, where before they were, very exacting.
Right.
And they really did very well because they weren't seeing things the same way.
Yeah. It's interesting. I worked with a Mexican artist who's very famous. I've gone into galleries and seen his work, and he has a eye turn, a binocular vision problem, and his complaint was that he's bumping into cars and things when he parks his car. And
not good.
We had a long conversation, and we decided not to fix anything because it would affect his artwork.
Get a chauffeur, right?
Yeah. I mean, I had that with Steve Elkington, the golfer. He had made adjustments over the years to do certain things and knew he had to vision problems, but we knew if we broke down his system and rebuilt it up the proper way, if you want to call it that, it would take a year maybe out of his career. You know, enough time out of his season anyway that we decided let's not do this. You know, you've compensated all these years, we'll leave it alone.
Well, therapy is a whole new field. All therapy with everything. In fact, I was just talking with this great doctor talking about DNA, and he was calling DNA therapy. I mean, you know, stem cell therapy. Right. I mean, we used to think therapy was, you know, for your brain. Right. Remember, you're sick, and we're going to give you a therapist. But
and they used to think that brain didn't regenerate or didn't change. You know, now the brain, we know it changes itself, neuroplasticity, which is why we can work with these areas. Visual field losses, I mean, I can show you some charts in my office where people had a field loss on one side, and we'll bring back a percentage of it by doing these procedures. You know, and I can show you where at Regents Park we work on the same idea. You know, can we bring back more sensitivity or sight in that blind field, we call it.
Well, it is very, very thrilling. And do you know if there are more men or women having this problem? I mean, is this it's just the general population as one ages?
Yeah, I haven't seen it broken down.
And this is an aging problem. You think there are any certain kind of vitamins or exercise that people can do to make themselves not have this?
No, I think you have to do, I don't think there's a vitamin you can take where you don't have to exercise anymore or walk or do things like that for your body. So it's the same as that. There are vitamins that help prevent macular degeneration. You can ask about them, see the formulas on the internet. But I think for this, what we're talking about with the eyes, you need to do some active little exercises, you know, like you would for your body, just simple as walking for your body.
Well, the computer, the beta site, we'll call it, on the computer is really very interesting. And I advise people to do it. How did they pay for, if they want to get on that? Of course, they go to you, and you do take Medicare, which I think is important.
Yes, take Medicare, or just call Sharon at my office. I don't know if you gave out the number, but
yeah, I'll be glad to give out the number. Not a problem.
And she'll walk you through
What's
it or
the
set
number?
you up. It's 561-479-1411, or call Regents Park. You know, they have a direct line to me.
Yeah, right. And the thing is, though, to make an appointment to see you, and then you will assess what the problem is, and then start a program. Well, Dr. Lambert, it's always such a pleasure. You're just a busy bee, and you're helping. Now I realize when people are playing baseball and doing things like that, that maybe you had a function. We'll have to get you to the heat. They still are missing baskets.
Yep.
Okay.
Right,
Thanks a lot, Dr. Lambert.